Hello, and welcome. I'm glad you're here. This is an audio version of the Data with Purpose blog series by Beata Faitli, where she explores how data-driven insights can transform health and social care, improve well-being, and create greater impact for families. Today's article looks at how big data is reshaping healthcare delivery through real-world examples and practical insights. Big data is revolutionizing the way care is delivered. By uncovering patterns and trends across large sets of health information, providers are now able to make more informed decisions, reduce costs, and improve outcomes for their patients. Let's explore some case studies that bring this transformation to life. One of the most pressing challenges in healthcare is preventing hospital readmissions. These are not only costly but often signal gaps in care. By analyzing patient data, including clinical notes and lab results, healthcare systems can now predict which patients are most at risk of being readmitted. With that insight, they can act early, offering extra support or closer monitoring to avoid unnecessary returns. For example, one major health system managed to reduce readmissions for heart failure patients by over 10% using predictive analytics. Another area where big data is having an impact is in emergency departments. Overcrowding and long wait times remain common issues. But by using data to anticipate how many patients will arrive, based on factors like previous attendance patterns and even the weather, emergency departments can better plan ahead. One hospital in New York successfully used this approach to streamline patient flow and cut waiting times by a quarter. In oncology, big data is enabling something truly powerful: personalized treatment. By drawing on genetic information and clinical records, platforms are helping doctors tailor cancer care to each patient's unique profile. This means more precise treatments, fewer side effects, and often better outcomes. A national initiative has shown how pooling data across providers can support these types of decisions in real time. Medication adherence is another long-standing challenge in healthcare. When patients don't take medications as prescribed, their health suffers, and so do outcomes. But now, with access to real-world data on prescription refill patterns, providers and pharmacies can intervene earlier. By sending reminders or offering support, they've been able to improve adherence and help people stay on track with their treatment. These examples point to the growing value of big data in healthcare. It enhances decision-making, giving professionals a broader and deeper understanding of patient needs and disease trends. It helps reduce costs by preventing avoidable readmissions and streamlining care. It improves outcomes through more targeted treatment and timely interventions. And it increases operational efficiency, helping to manage patient flow, optimize staffing, and improve scheduling. Of course, these advances don't come without challenges. Protecting patient privacy and ensuring data security are essential. Handling sensitive health information responsibly must always be a top priority. There's also the challenge of bringing data together from different sources, systems that weren't designed to talk to each other. Integrating these systems takes time, effort, and investment. Then there's data quality. Poor data leads to poor decisions, so governance and accuracy are critical. And finally, we can't ignore the skills gap. For big data to work in practice, we need professionals who not only understand healthcare but know how to interpret complex data and translate it into action. Despite these challenges, the potential is clear. Big data is helping healthcare providers around the world deliver safer, smarter, more efficient care. From the emergency department to long-term chronic condition management, the message is the same: data, used purposefully, transforms care for the better. Thanks for tuning in. I hope this reflection offered new insight or sparked a fresh perspective. At the heart of everything I share is a simple belief that when we use data with purpose, we don't just improve systems, we improve lives. Until next time.